Hello everybody! In today's video, we are going to be covering the last couple of things we need to talk about with your respiratory system. Of course, this is going to be the fun video for me, not so much for those suffering from this, but we are indeed discussing diseases and aging as it affects your respiratory system. Those are the last two objectives you have. Those are objectives 22 and 23. So let's get into covering them. Objective number 22. Discuss the causative agents and implication of chronic bronchitis, emphysema, asthma, tuberculosis, and lung cancer. Basically, we're happily going to discuss all of your diseases right now. We've mentioned a few others in other videos that you've dealt with, but we're going to delve into some specific ones now, and I'm going to attempt to anticipate and answer some of the questions that you guys have for me as far as these things go. Because I generally, when we start talking about this in person, start getting asked a lot of questions about smoking and vaping, right? So I'm going to anticipate some of those questions and try to answer them with this video about diseases and such, right? So we started talking already with some other diseases, like we discussed how a lack of surfactant in preemies, basically, because the lungs develop last in pregnancy. See, this is your week counter, and these are your bronchial tubes and terminal bronchioles developing. The alveolar sacs don't finish developing until the last few weeks of pregnancy, and your surfactant levels may not be high enough. Without that, your baby may develop respiratory distress syndrome. It's primarily in premature infants due to insufficient surfactant within the lungs, right? That means they're going to have dyspnea, which is poor breathing, and poor gas exchange, low oxygen levels. This can lead to a number of other bad issues like septicemia, which means they may go septic with an infection. So treatments may include everything from intubation, CPAP machines, resuscitation if the breathing is bad enough and they need to be resuscitated. There are other treatments, right? Other diseases, though, that you guys should know about. COPD, right? We have discussed some illnesses going throughout these videos where they fit. COPD is chronic obstructive pulmonary disease. You probably see commercials for this all the time on the TV, right? Or commercials for various medications for this all the time on the TV, right? So this is caused by chronic asthma and bronchitis infections. Or chronic asthma, bronchitis infections, as well as any other obstruction to your lungs, like emphysema. The general basic gist of COPD is patients have difficulty getting air out of their bodies, right? So patients have difficulty getting air out or breathing out. Because of this, because of the obstructions, the patients cannot exhale well, right? In the medical community, the sort of not polite nickname for people like this are called blue bloaters, because they cannot get air out or push air out of their body. That means that the air has to stay somewhere, so it is staying in the patient's lungs. If this sort of means their lungs are becoming like an overfilled balloon, right? And that's going to cause the individual to develop a more barreled chest to make room for the air that they can't breathe out. And therefore, they're going to look more bloated, probably blue because of or a little bit of a blue tint because of that lack of oxygen, because they can't exhale well. I apologize for that tongue twister. But that's generally the point of COPD, or what COPD is. Something is obstructing your pulmonary system, and you can't breathe out very well. On the flip side of things, emphysema is caused by damage to the lungs and airways. Something is blocked. And emphysema prevents individuals from being able to take air in, meaning people cannot breathe in with emphysema. Right? Your medical nickname for emphysema would be a pink puffer, because people who have only emphysema, right, tend to take fast, more frequent, short breaths. Because of that, their body is using way more energy to breathe, so they are going to be thinner. Because breathing is an active process and it takes energy, so the act of breathing is going to burn more energy in these people because it's harder for them to breathe. So the person is using more energy just to take in a bunch of these short little breaths to try and get enough oxygen. So they're going to end up being more thin. Like, they're going to end up being thinner than your average patient and looking and feeling more worn out, probably with a little bit of a pink color to them, right? The downside of life is these two things are not mutually exclusive. It is 100% possible and frequent that someone will have both conditions. This is not a choose one or the other thing. If you have smoked long enough and you've done enough damage to your lungs, it is 100% possible that you have both issues getting air into you, and you can no longer breathe air out adequately either. So it is 100% possible to have both of these conditions. Right? And as a matter of fact, emphysema is the current leading cause of COPD. Right? So some common features and causes of this, right? 80% of patients who have one of these two illnesses or both have a history of smoking. So this is strongly linked to smoking. So 80% of patients have a history of smoking that have these conditions, right? Common features of this also include coughing and frequent pulmonary infections. So they can't breathe very well, and they are prone to getting bronchitis and other type infections. Most patients who have both of these, especially with hyperventilation, are going to develop respiratory failure, accompanied by respiratory acidosis, which we have discussed earlier. It's when, because of your respiratory system, you have too much carbon dioxide in you, and you develop an acidic blood level because of it, which is going to negatively affect everything, right? So I'm going to go ahead and answer your smoking questions that I normally get now. Because of this, right? This is heavily linked to smoking, and yes, we're going to talk also about lung cancer, so be prepared for more lung cancer smoking information. But it's not just what you're smoking, right? When you are smoking, and I know what I'm saying is about to sound like completely insane, when you're smoking, you have lit the cigarette, right? And there is ash involved, and then you are inhaling some of that ash to get whatever you want from what you're smoking. Ash, from a chemical perspective, when you start talking about just like the basics of stages of matter, and I know this sounds crazy, but ash is not a gas. Ash is a solid. Smoke is a solid, because you are smoking in itty-bitty tiny pieces and shards of ash, or the burned material that you have been burning. So smoke is actually a solid. Your lungs are not made to handle breathing in microscopic solids. This is why you have some amount of protection with your lungs. Remember, we've gone over all of the mucus linings and things like that. This is why when people initially start smoking, generally speaking, there is a coughing phase where they're also coughing up black tar with that, because their body is trying to get it out of them. Right? So the act of smoking itself can cause damage. If all of that smoke builds up with the mucus and surfactant and other liquids and stuff you have in your respiratory system, it can cause blockages, which we know if you suddenly blocked one of those alveolar sacs because you ended up creating a blockage at a terminal bronchiole or a respiratory bronchiole, it would inevitably cause the collapse of that entire alveolar sac, meaning that entire alveolar sac is dead space and will not help you transport anything. It's going to increase your chances of infections as well because you're breathing in outside material. You're inhibiting your immune system's ability to keep you clean and protect you. The heat from the smoke that you're smoking in can also mess with things because of the gas laws. Remember, we've already discussed how temperature can affect that gas exchange and gas laws within your lungs. So that can also, the heat itself can cause damage to your lungs if you're smoking. So it doesn't necessarily matter what you are smoking. In the debate between things, in the debate between smoking a joint or smoking a regular cigarette, either way, you are building up that tar and ash inside your lung that's not supposed to be there, and there is a risk of heat and other such damage because of that. So it is 100% possible to not smoke cigarettes, but to be I was at like Woodstock hippie that smoked pot all these years and still end up with COPD or emphysema because of the damage done to your lungs just from the smoke and the ash and the collapse of those alveolar sacs, or the hardening of them, because enough of that tar and buildup can actually cause the alveolar sac itself to harden instead of collapsing. Either way, you can cause damage, whether it be a joint or a cigarette if you're smoking, just from that stuff alone. That being said, cigarettes also come from nicotine. Nicotine as a plant is in the same plant family as deadly nightshade, which is why you can't just go out and pick nicotine and eat it raw. You will die. Nicotine has to be cured first, so silos at tobacco plants, tobacco has to be cured. You can't just go out and eat raw tobacco. It has to be cured before consumption, so tobacco silos basically bake or heat up the tobacco leaves until they have dried and withered and essentially cured, which is what's then chopped up and put in cigarettes. But some of the byproducts of that curing process, as well as the nicotine being in there, is also some arsenic and cyanide on the outside of the leaf that you are also burning and inhaling in. So you are getting some chemicals from the deadly nightshade family of plants when you're smoking cigarettes. On the flip side of things, with marijuana, if you are smoking a joint, it depends, right? You're getting THC and the other chemicals that are associated with marijuana as opposed to the poisons from nicotine. Some people, that's not going to go over very well for you. It is possible to be allergic to pot, just like it is anything else in the world. And some people don't have the best reaction to that sort of thing, while others are perfectly fine with it. But side effects, other than being cyanide, arsenic, and nicotine, some of the side effects of marijuana can be increasing appetite, right? So you want to eat everything around you. It may make some people paranoid, so if you are prone to mental problems such as schizophilic stuff like schizophrenia, maybe don't smoke pot, because paranoia plus schizophrenia is not going to be good. But it can also help relax you a bit as well. This is why marijuana is now quickly in the country becoming a legalized medicine. Because if you are on chemotherapy and the chemotherapy for your cancer has killed your appetite and is killing your fast-growing cells, the doctors want to give you something to increase your appetite so you can keep energy. So they may prescribe you medicinal marijuana to up your appetite. It may chill out your anxiety, which could be good for you. So your doctor may prescribe marijuana to chill you out a little bit. So the side effects for marijuana could, under certain circumstances, be potentially good. But, like I said, if something's wrong and you have schizophrenia and you're prone to paranoia and the THC in marijuana increases your paranoia, you're going to want to stay away as far away from that as possible. So just like everything else on the planet, there are good sides and bad sides to it, and there are reasons why it is a prescribed medication at this point. Right? So that covers the difference between smoking joints and smoking cigarettes that students always ask me. But wait, what about vaping? What if I'm not smoking either and I'm vaping, you ask? Vaping is new. Remember, I'm recording this in 2020. Vaping is such a new Wild West frontier and field that it is not 100% regulated yet. The purpose of vaping is, instead of inhaling all of that ash, they have just chemically given you the stuff in water vapor, and you are sucking on an electronic pen that is essentially heating up a water vapor cartridge with the chemicals you want in it, so you can inhale directly with the water vapor. So if you're trying to quit smoking, and you have a Juul that has nicotine in it, they just gave you the nicotine mixed with water as the pack that you plug into that e-cigarette, and you're getting that without the tar, without the smoke, without smoking in all that ash and whatnot. So there are pluses, good and bad sides to vaping. But the issues with vaping is that it is 100%, it's not fully regulated as an industry yet. So that vape pen that you may have been made quickly and shoddily in China, and there have been cases where people reported that, their vape pen was in their pocket, suddenly heated up, and the battery exploded. Because there's no real manufacturing requirements or FDA approval thing for it yet, because it's a new field, right? That means that if you're smoking on one of those that's due to go haywire, it could really, really just make the water vapor that you are inhaling way too hot and cause damage to your lungs from the temperature aspect of things. They are also seeing an increase in problems like pneumonia right now from vaping, because there is no, how should I put it? There's no regulation on the actual clarity of the water vapor in the vape pen. So if it's not kept clean, or if it's just a shoddy company that doesn't care that much, if the water was contaminated with something and you inhale it, you may have just inhaled something that is going to cause an infection in your bronchial tubes and give you bronchitis or something like that. Remember, the air inside your alveoli had more water vapor in it than otherwise, and if you mix the water vapor from your vape pen with that and it was carrying germs and other infectants, there may be consequences to that. So vaping right now is sort of like the industry of making the vape pens and selling them. Yeah, you have to be 18 to buy it if there's nicotine involved, but the actual devices and whatnot is pretty unregulated as of right now, because it is a new industry. So if you are into that sort of thing, please try to be smart with your bodies, pick and choose your companies wisely, and don't, if you read online reviews where a company is just doesn't care, try to avoid their products. Try to be good to yourself. Right? Yeah. So we're going to come back to the smoking thing when we touch on lung cancer a little bit, but first we're going to go back in time now to discuss tuberculosis. TB. If you work in a hospital, you have probably had a TB test done before. I don't know if you knew what a TB test was, but they were testing you for tuberculosis. Tuberculosis is a bacterial infection that's spread through Mycobacterium tuberculosis. That's the appropriate biological name of the bacteria. TB used to be a super big deal. It still is a super big deal if you get it, by the way. Because in tuberculosis' history, it's a bacterial infection that at one point killed a third of the population of Europe. So the Black Plague beat it, but we're still talking about this one because it's important, right? It's an airborne disease, and it infects the lungs, right? Tuberculosis can lie dormant for months inside an alveoli, and it creates like a little barrier around itself as a bacteria, so that the macrophages within your alveoli don't immediately kill it and eat it. And it waits for a time when your immune system dips down or gets weaker before it emerges and starts giving you a major infection, right? So it can actually lie dormant for months until your immune system is busy with another illness or compromised somehow from, like, God forbid, HIV. But tuberculosis is highly contagious. It is airborne. It's an airborne illness. You can sneeze it or breathe it onto somebody. So tuberculosis is highly contagious. Like I've said, it's killed a third of Europe's population in our history, right? Fancier terms for it because tuberculosis was actually a pretty common illness for people to die from until the invention of antibiotics. Like, this was one of the best things that penicillin helped with other than war injuries, right? But penicillin, as it turns out, kills the tuberculosis. So before the discovery of penicillin in 1914, deaths from tuberculosis were a lot more common. And even, within the generation and a half after the discovery of penicillin, were tuberculosis deaths still also pretty common. Nowadays, we treat tuberculosis with antibiotics, but there you go, right? So, like, if you're ever reading romance novels or old books and that kind of thing, for an English class or whatever, around the Victorian era, they started calling tuberculosis consumption. So if a character in an old novel died from consumption, they had TB, and they died. So, yeah, penicillin cures most strains of tuberculosis, although now doctors are slightly worried and panicked because there are a couple of antibiotic-resistant strains of tuberculosis, and they do not want those spreading. They are kind of panicked about that. We do not want antibiotics to get to the point where... We do not want the penicillin bacteria to get to the point where it has... I don't know. We do not want the tuberculosis bacteria to get to a point where it has evolved immunity to penicillin. That would not be good for the planet as a whole. Right? So doctors do panic about the penicillin-resistant strains of TB. But current treatment after being hospitalized for tuberculosis right now is being hospitalized during the contagious stage. And then they give you a 12-month course of antibiotics. Right? Untreated and historical patients died either from the fever that tuberculosis itself caused or from drowning in their own blood, because the tuberculosis infection is in your lung lining and the alveoli, and it just spreads through those pores that are in your alveoli, so it can cause them to burst, which will cause the capillaries to also burst. So once again, if you're talking about an old-timey movie or an old-timey novel, or a novel that takes place in the past where you have a character that's coughing blood up on a tissue, that's tuberculosis. Like Moulin Rouge, your main character died from tuberculosis. And no, that is not a spoiler, because the first line is the movie is "The woman I loved is dead." So I did not ruin anything for you. But yeah, so some symptoms of tuberculosis, historically speaking, include things like fever, night sweats, a racking cough, an inability to breathe, weight loss from the hardship of breathing, and coughing up blood, right? Please see your doctor if you're coughing up blood. That's not a normal thing to do, right? Lung cancer, right? Lung cancer, something else that we all must deal with. Lung cancer, 90% of lung cancer cases are caused or linked to smoking. Once again, smoking bad, please don't do it. I know you all have free will and you're going to do what you do, but full disclosure, I'm telling you what it can lead to. And I'm sure you guys already know that, but still. Right? So 90% of lung cancer cases are linked to smoking or caused by smoking. right? There are 3 major types of lung cancers which you do indeed need to know. Squamous cell carcinoma, right? That's about 20 to 40% of your cases. That's in your bronchial epithelium. Adenocarcinoma is about 40% of your lung cancer cases. That's going to originate in the peripheral lung areas and tissues, right? And then small cell carcinoma, that's about 20% of your lung cancer patients, is going to contain lymphocyte-like cells that originate in the primary bronchi and subsequently metastasize. The one that is the most deadly, that will metastasize the fastest, is the small cell carcinoma. You should know which type of lung cancer is the deadliest. That is indeed the small cell carcinoma. Right? Mesothelioma is also a type of lung cancer, which you guys have seen all of the commercials about mesothelioma ever, right? Mesothelioma is that, do you have a loved one that has been exposed to asbestos in their lifetime? Call this lawyer so we can do a class action lawsuit. Every single one of you guys have seen those commercials on the TV, right? That's because mesothelioma is a very, very specific type of lung cancer that is found in the linings of the lung, that's in your lungs pleura, right? That is specifically caused by asbestos, right? And some of you guys may not know what asbestos is, right? So some of you guys may not know what asbestos is because it was banned in the US until the 70s or 80s. Or it became banned in the 80s, I should say. So asbestos is a material that is found, it is a naturally occurring material in the earth. And the catch with asbestos is it is a remarkable, fantastic insulator. Like a remarkably fantastic insulator. That means it's super, super awesomely good at keeping things hot or keeping things cold. And to make things even better, it is not that flammable. It does not catch on fire easily. So when it was discovered and when they figured this stuff out during the Edwardian period, I don't know if you guys know your history time periods or not. I'm sorry for that stall out. So the Edwardian period, if you don't know it, it's like the super beginning of the 20th century. We're talking like 1900 through to the First World War. Right? So we're talking about 1900 to World War I, basically. So it's the small time period that's right after the Victorian era. If you didn't know your history stuff, because I'm also a history nerd. But asbestos was discovered then, and it was also discovered that, hey, it doesn't catch on fire easily. So they started using it for insulation in houses, right? Because from my initial description, that sounds like the perfect stuff to insulate your house with, because it will keep your house cold when you want your house to be cold, and it will keep your house warm when you want your house to be warm, and it's not going to catch on fire easily. Huzzah, that sounds fantastic. And we used that in our houses and public buildings and schools and government buildings and that kind of stuff for a super-de-duper long period of time. Like, through to the 1950s and whatnot. And army contractors were building more army bases after World War II, right? Because we used this stuff for a super long time. And all of a sudden, all of these army-based contractors that were building these army facilities, because asbestos is also cheap. So it's a really good insulator, doesn't catch on fire, and it's dirt cheap. So, if you work in construction, that sounds like the best thing on the planet, right? However, people who were working close to asbestos, and especially in these military compounds, that were military contractors building military bases all of a sudden started getting lung cancer and dying because they were inhaling this stuff. It turns out asbestos on a small, tiny microscope level, the fragments of asbestos are like little bitty shards of glass, and they split off from the hunks that you are using, and they become airborne, and then you breathe them in, and once you breathe them in like small shards of glass, they float into your lungs, stab you, stay there, and then give you cancer in your pleura. And that very specific type of cancer that asbestos will cause if you have inhaled enough of it is called mesothelioma. This is why you see so many types of class action lawsuit commercials for it, because until the 80s, this stuff was being used before our EPA and other regulatory committees said this stuff is too dangerous to use. We're banning it from the country. No longer use this anymore. Done deal. Until the 80s, people were just like lining buildings with this stuff if you worked in construction. Or even if you were just one of the employees in the government building, if they redid the government building and didn't vacuum out all the asbestos and whatnot, and you were the secretary that came back to the office and just had to sweep and mop and dust all of the construction dust off of it, you inhaled that stuff too. So there are a lot of class action lawsuits toward the companies that made their employees inhale this stuff for longer than they should have, because as with most things in life and time, the companies knew that it would hurt their employees way before they actually did anything about it, right? Because humans can be terrible, and this is what we do. Because history, yay, we've never done anything different. But that's what mesothelioma is in that form of lung cancer, in the event that you needed to know, so you should know about that one. And then because of the current situation in the globe, I'm going to tell you a little bit about COVID-19. Right, so the reasons why we're doing this class online instead of face-to-face, and all that kind of good stuff, right? So COVID-19 is a mutation of the coronavirus. Coronavirus was something discovered in the 70s, which is why all of the Lysol containers say that it kills coronavirus, because it does, and because it was discovered in the 70s. COVID-19 is just the newest mutation of the coronavirus. The second newest mutation of it was SARS, if you guys kept up with the news from a few years ago. So the sister virus of COVID-19 is SARS, which is actually named COVID-2. Right? So the SARS virus that hit Asia a few years ago is called COVID-2. This time we have a global pandemic of COVID-19, right? This virus is going to infect the lining of your lungs, right? And it spreads quickly with a 2-week incubation period, which is the thing that's messing up all the time frames, right? Because you can be coughed on, or you can go into an elevator and be sneezed upon by Bob that works a few floors other than you, and the COVID-19 can incubate for 2 weeks or 14 days after you were sneezed upon, so that makes tracking it a little bit more difficult, as well as keeping track of exposure numbers and that kind of issues. So most patients are going to experience an illness like a bad cold. So I have personally known 2 people who have had COVID. One person said it was like having a cold that had a cold, and she felt terrible for 2 weeks, right? So for some people, it can be like experiencing an illness like a super-de-duper bad cold. But if you are really like infant young, the elderly, or if you're immune compromised or have some other type of illness, the fact that this is infecting the lining of your lungs can lead to acute pneumonia, sepsis, and death. Which is why, and depending upon how quickly that pneumonia comes on, may determine if you end up in the hospital in the ICU on a ventilator helping you breathe, and they don't want that infection to end up getting into your bloodstream and going septic, which can kill you, and of course, if you can't breathe, you die. Which is what the worry about this is. I mentioned that I have 2 friends that have had COVID. One of them, the smoker of the two, said it was like having a super bad cold, right? And she didn't care. The other one, though, doesn't smoke, and for whatever reason, it kicked her butt way harder, and she had COVID back in February or March, and she still has difficulty walking across the room without getting out of breath, because for whatever reason, it, threw her over it threw her a major curveball, and she may have lasting scar tissue on her lungs because of it, which is a major concern for patients that have had COVID, because if it affects you that badly, the infection itself can scar up your lungs, and in really, really bad cases, that may mimic COPD. And we don't know the long-term effects of COVID-19 yet, based upon those kind of preliminary results. That's why everybody right now is being super cautious, why the schools have decided it's better for us to do this online than in person, all that kind of good stuff, because everybody is everybody is attempting to be proactive in mitigating the spread of this, because we don't know what the long-term effects can be, and we don't 100% understand why it is affecting some people, like a super bad cold, but others, it is like mugging them in the back alley, if that makes sense. We just don't know yet. There hasn't been enough time or research, and it's a new enough infection that we don't know. Scientists are doing research into that now, but that's pretty much where we are right now in 2020 with it. But now you guys understand and you're caught up, right? Those are all the diseases we need to talk about. We are super quickly going to talk about age. So Objective 23 is discuss the normal respiratory system changes that happen from infancy to old age, right? Your lungs are the last thing to develop during fetal development, as I've mentioned earlier, either in this video and others. So until birth, oxygen is exchanged through the umbilical cord via the mother, so baby doesn't need to breathe and is surrounded by amniotic fluid when it's inside mom. There's no reason for the lungs to form earlier than that, right? So damage to the lungs builds over time. So your body, you can be damaged a little bit and heal, and you're going to have that ebb and flow throughout your entire life. So damage to your lungs is going to build over time, and lasting damage compiles. That means elderly individuals are more likely to have more lung damage because the damage piled up, as well as having thinner epithelial linings, because we know things thin out like that as you get older. And we know that your ability to heal quickly, and you have a slower immune system when you're elderly as well. So those things will impact your respiratory system just like everything else in your body, right? Lifestyle will greatly affect your respiratory system as well. Yeah. Excuse me, I'm sorry. But lifestyle is also going to greatly affect your respiratory system. So if you were an 80-year-old housewife without dust allergies, you're probably going to have healthier lungs overall that will last you longer, as opposed to comparing your lungs to, for example, an 80-year-old man who worked as a coal miner his entire working days. Lifestyle is going to affect your lungs greatly. So what you could breathe in and out on a daily basis, if you were a smoker or not, occupational hazards like coal mining, that cancer is a very high occupational hazard for coal mining, by the way, because you are constantly inhaling coal dust and coating your lungs with that, and that is not good for you either. So there are some occupations where this would be important to understand and know about and think about. But yeah, pretty much same deal. Things are going to start breaking down as you get older. Lifestyle is going to affect this greatly. If you have any questions or comments, please let me know. I look forward to seeing you guys in the next one. Have a wonderful day. And that's it for your respiratory systems.